Let's bring in Congressman Drew Ferguson from the House GOP Doctors Caucus. Okay, Congressman, let's go through the states first, where the healthcare workers and the nursing home workers are saying, you got to go if you're not going to get vaccinated. We're talking New York, Missouri, Massachusetts, California. We're also seeing Rhode Island and Connecticut. So there's that going on. But, you know, people are saying get vaccinated if you're going to be working closely with patients and nursing home residents. Where do you come down on this debate? Should people who are in these jobs get vaccinated? What do you say?
Well, Liz, the first question we need to be asking is, why is Joe Biden continuing to push vaccine mandates that are unwanted and unnecessary on the very people that we're asking to keep us safe? It's wrong. Americans are tired of this. They're pushing back on it, and they're tired of the hypocrisy. Healthcare workers and first responders understand infection control protocol. They understand the risk and benefits of the vaccine, and they're making informed decisions for themselves and their families. We have leaned on our healthcare heroes so far to keep us safe and to treat us when we get sick, and now we're in the midst of firing them. It's not right.
Yeah, we hear you. I mean, rural communities are going to get hit really hard. You know, you're right. We went from cheering and applauding them as heroes in the pandemic to now firing them. We hear nurses saying, this is insulting. We feel demoralized. It's like we're not intelligent enough to make these choices for ourselves. But on the other side of it, people are saying, listen, get vaccinated. You risk infecting us, infecting patients. We know that we've had smallpox vaccines, polio vaccines, swine flu vaccines, measles, mumps. What is the difference here? What are we missing in this?
Well, first of all, healthcare professionals, particularly our nurses, understand infection control protocol. They know how to keep people safe. They do this every day with other infectious diseases like tuberculosis, hepatitis B, HIV. They understand how to keep themselves and the patients safe. But here's the problem. The mixed messaging coming out of the White House has been atrocious. You have the FDA saying one thing, you have the CDC overruling it, you have all of these mixed messages coming out. People are making informed decisions after they've talked to their healthcare workers, and they're entitled to do that.
Yeah.
This is something where Americans are sick and tired of being told what to do, being told what to do by big government socialists.
We want to talk about the mixed messaging. Watch this.
No, I don't think it should be mandatory. I wouldn't demand to be mandatory, but I would do everything in my power. Just like I don't think masks have to be made mandatory nationwide.
That's not the role of the federal government. That is the role that institutions, private sector entities, and others may take.
So here's the thing. We cannot require someone to be vaccinated. That's just not what we can do. It is a matter of privacy to know who is or who isn't.
You don't want to mandate and try and force anyone to take a vaccine. We've never done that. You can mandate for certain groups of people, like health workers, but for the general population, you can't. But we don't want to be mandating from the federal government to the general population. It would be unenforceable and not appropriate.
Okay, your reaction to that. By the way, about a dozen states have vaccine mandates for health workers and nursing home workers. The president's saying 17 million healthcare workers at health facilities that get Medicare and Medicaid should be fully vaccinated. Given what you just heard, what is your response to all of this?
Every person that you just played, they were opposed to vaccine mandates, and now they're for them. A perfect example of the mixed messaging, and that is why Americans at a time when they should be able to trust the CDC and the federal government don't. And that is squarely on the shoulders of big government socialists like Nancy Pelosi and Joe Biden. Look, Americans should go talk to their healthcare professionals. They should make an informed decision. They are capable of doing that, and they're doing that every single day. And to see this about face from the administration leads to distrust. It is wrong. There's one crisis after another, the border crisis, the Afghan crisis, and now there's a crisis in confidence in the White House.
All right, Congressman Drew Ferguson, it's great to have you on. It's good to see you.